Welcome to my channel. Currently, due to career, education and other reasons, many people prefer to take some time for pregnancy planning. Also, many people want to take a break for a few years after having a child. Regardless of the reason, if you decided to practice birth control, it is essential to use some form of contraceptive method. Among the various birth control methods, pill and condoms are two popular options. The problem is that it is difficult to take regular pills. Besides, many couples come close for 4 to 5 days after 2 to 3 months. So, it is hassle to take pill for the whole month. On the other hand, some people may feel uncomfortable using condom. In such a case, emergency contraceptive pills are chosen. After taking emergency contraceptive pills, it is observed that for many, the menstrual period does not occur in the expected date. In today's video, I will discuss what to do if menstrual period does not occur on the time after taking emergency contraceptive pill. Before that, we need to understand some basic fact about emergency contraceptive pill. How does an emergency pill work? Emergency contraceptive pills work by preventing ovulation. Ovulation is the release of an egg from the ovaries of women, which occurs monthly as part of the menstrual cycle. During ovulation, if sexual intercourse takes place and sperm fertilize the released egg, it is lead to the formation of a zygote. Is called fertilization. Fertilization is the process by which male sperm combine with the female egg. After fertilization, the zygote travels into the uterus and implant itself into the lining of the uterus. This process is called implantation. The emergency pill is essentially a hormonal contraceptive. After taking the pill, hormonal changes occur in the body. Emergency pill prevent pregnancy in 3 ways. Number 1, they act as an emergency contraceptive pill prevent ovulation in women or delaying ovulation, which can prevent the union of eggs and sperm, avoiding conception. Number 2, in women's uterus there is a slippery discharge like white part of the egg called cervical mucus. When it comes out through the genital tract, we also call it white discharge. This substance assists the sperm in entering the uterus. Emergency contraceptive pill make the cervical mucus thick and streaky, prevent the sperm from entering the uterus. If the sperm cannot enter the uterus, fertilization cannot occur and pregnancy will be avoided. If ovulation has already occurred or if the egg and sperm have already combined leading to fertilization, the emergency contraceptive pill prevent implantation of the fertilized egg in the uterus. In other words, it does not allow the fertilized egg to attach to the uterus. This is how the emergency contraceptive pill works to prevent pregnancy. However, if implantation has already taken place, meaning pregnancy has occurred, then emergency contraceptive pill will not be effective. Therefore, a pregnancy test come positives, do not take emergency pill. It will be not terminate a pregnancy. Why is menstruation not on time after taking the emergency pill? After taking emergency contraceptive pill, menstruation may not occur on the time for two possible reasons. Number 1, the pill may not have worked and you might be pregnant. Although the chance of pregnancy are significantly reduced if the pill is taken correctly. Its effectiveness depends on how soon after intercourse you take the pill. Taking the pill promptly after intercourse increases its effectiveness. If taken too soon after intercourse, the possibility of pregnancy is closer to 0. Number 2. The second reason for not having your period on time after taking emergency contraceptive pill is menstrual irregularities. If you don't get your period on the time after taking emergency contraceptive pill, there is no need to panic. Initially, if you miss your period, wait for up to 10 days. It is hoped that within this period, your period will likely occur. Even after waiting for 10 days, if your period does not occur, you can take a pregnancy test using your first morning urine. If the pregnancy test result is positive, it indicates that you may have conceived. and you should seek a medical advice. If the pregnancy test result is negative, it is suggests that your period may be irregular due to the emergency contraceptive pill. If your period is irregular, it is advisable to consult a gynecologist. Generally, taking some medication can regulate your period. There is nothing to fear. It is won't cause difficulties in having child in the future. However, if you frequently take emergency pill, it may pose problem later. Avoid making the big mistake to considering emergency pill as a safe option just because of flashing media advertisement. No more today. Hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel for get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.